All right, guys, let's go dive right into it. In the previous training, we discussed COE scale, and we talked about three medications that are FDA approved. Now we are going to talk a medication that prevents or should prevent anyone from drinking alcohol or touching anything that has alcohol in it. My name is Dr. Lopez with NP exam coach. Let's go ahead and discuss those uh, important aspects so you can ace your PMHNP board certification. Okay, so this is our roadmap. The Sulfuran, conquering alcohol use disorder, and here is the Sulfuran, right? So it is also known as aversion therapy to treat alcohol use disorder. Why? Because it has a nasty side effect if one do so while taking um, disulfiram or anti-abuse, right? So basically, it requires a waiting period of 12 hours from the last drink. Why? Because it takes that much long for the alcohol to be out of the system, right? Before you initiate, 12 hours before you initiate. Once you initiate, you have to wait 2 weeks to drink alcohol again because of the half-life of this medication. It's so strong that after stopping taking this medication within 1 week, if the patient drinks alcohol, they will have a side effect. So they have to wait 2 weeks after stopping taking the medication and 12 hours before starting taking a medication once alcohol is consumed, right? So, what do you want to teach the patient? Because it's such a pleasant feeling. You want to teach about not using any medication or product with alcohol. So, does it mean vinegar? Yes. Perfume? Yes. How about shaving lotion? Yes. So, for 2 weeks, during the treatment or for 2 weeks after discontinuing this medication, they have to stay away from alcohol unless they wanted a very bad side effect. Okay, so what do you want to monitor for? This mechanism, this medication really it's a bit harsh on the liver, so you want to ensure that you have your LFTs before you prescribe this medication. You want to monitor for liver enzymes is essential. So here, waiting period as the patient should start taking the medication the morning after a day without alcohol consumption. The products to avoid, you want to share a list of alternative alcohol-free products with the patients for the daily use, right? So that being said, how would you remember dial disulfiram I for the 12 hours since the last intake of alcohol, the A, avoid alcohol products, and L, liver enzyme monitoring. So dial for disulfiram, for D for disulfiram, I for 12 hours. You can make the I be 1 or intake of alcohol. A for avoid alcohol product, and L for liver enzyme monitoring. So, frequent tested points. The mechanism of action is aversion therapy. Without getting too much detail, we can call it aversion therapy, waiting 12 hours before initiating the medication since the patient had been without alcohol for 12 hours. Contraindication and interaction with products with alcohol. Potential side effect will be liver issues. Must wait 2 weeks after stopping the suffering to consume alcohol again. Um, just increases the accumulation because it increases the accumulation of acetylglycolides, causing the unpleasant symptoms. So that's more of a technical term here, You don't have to know this, but just more of a FYI kind of thing. Now, one thing too that you want to probably be aware of is that Depakote and the Sulfuran, both of them increase the INR, so risk for bleeding. It's a side note. What else? If you remember the medications that cause mania, right? What are they? You remember that steroid causes mania. The sulfuran can cause mania. What is that? Acianidite, the TB medication, and antidepressants can too cause mania for those that are at risk for bipolar disorder, right? Uh, what else? So the sulfurane used for the treatment of alcoholism by producing acute sensitivity to the ethanol. Small doses can stay in the body for up to 12 weeks. 2 weeks, I'm sorry. So remember that it is one of the medications that can cause mania as well. So check on learning. The sulfurane is a medication primarily used for the treatment of alcohol use disorders. Which of the following best describe the mechanism of action? It reduces alcohol cravings by increasing the dopamine levels. It inhibits the enzyme aldehyde dehydrogenases, causing accumulation of acetaldehyde. It blocks the effect of opioids receptors to reduce alcohol pleasure effects, or does it assist in the detoxification process by removing alcohol from the body? This one, it was a given. I just covered that. That's an alcohol aversion therapy. And the answer is B. And then you have the incorrect choices A, um, C, and D, and the rationale for it. Please take a look at it. Okay, moving on. And this is it. This is a wrap for the desulfuran. Remember those points that we went over. Um, so that way, if you get a question, the desulfuran, most likely these are the high yield about this medication. My name is Dr. Lopez, and I can't wait to see you become board certified. So long. Bye bye.